Good morning, everybody. Welcome to the session. And just to start by saying I really appreciate everyone being here. Those of you in the UK, bright and early at 8 o'clock. And it's lovely to see some chatting going on. So do feel free to keep introducing yourselves, where you're from. And I can see we've got some people joining us this morning from the UK. We've got Liverpool, I've seen Norwich, and then we've also got from abroad, Rotterdam, Pakistan, Iraq, Athens, New Forest, Turkey. So what an amazing kind of international group we are this morning. So my name's Lee David. I'm a GP with an interest in CBT and mental health. And I also have a clinical role working for the Practitioner Health Service in the UK, which is an organisation supporting doctors with mental health problems. So we're just going to start this morning with a little poll. I'm going to then talk a little bit about mindfulness just for a few minutes, and then we'll do some mindfulness practices. So I'd just like to, we're going to put up a poll now just to find out what kind of experience you have of mindfulness. But also alongside the poll, I'd really love it if you would type into the conversations box what you'd like to get out of mindfulness. What would you see as your biggest benefits as a clinician from practicing mindfulness? You know, what brings you here today? So if we could answer the poll, you know, what's your experience of mindfulness? And well, that's a live, so we'll see the numbers coming in there. But also if you could just type what reasons you have for joining us today. You know, what would you like to learn about mindfulness? That would be really helpful for me as well. So let's having a look. So the answers we've got, so about 39-40% of people never tried it before. A good proportion, sort of 37 people, 37% have tried it a few times, but not regularly. We've got a smaller number of people who do practice regularly. So 7 of you practicing once or twice a week, and then 3 of you managing to practice more than 3 times a week. And we're starting to get some answers as well for what people would like to, the sort of benefits. So wanting to feel less stressed, I think that's very common. How to use it in everyday practice with work stresses. So it's kind of bringing it into daily life, I guess, managing stress and burnout. And there is some evidence that mindfulness does help, particularly for people who are interested, you know, so if it's something that you're drawn to, then that can be really helpful. And my view is it's about small bits of mindfulness. It's not about necessarily having to do a really long practice. It's about finding little kind of ways to bring it into your day-to-day life through your busy working days as clinicians. So how to do it properly? Well, we'll have a think about that today. I mean, I think actually there's lots of different ways to do mindfulness, and that's one of the kind of joys of it in many ways. Okay, so I think we'll leave the poll there and move on. I'm going to talk a little bit about mindfulness now. So what even is mindfulness? Well, John Kabat-Zinn, who's one of the kind of founders of mindfulness as we know it in the kind of modern format, would describe it as paying attention in the present moment and non-judgmentally, or in other words, knowing what you're doing while you're doing it. So it's just being aware of what you're doing, whatever that may be. It might be being aware of your breath, but it might also be being aware of your thoughts, being aware of your emotions, being aware of your physical sensations, your tension, and then making choices about what to do based on what's going on for you on the inside. So some of the key aspects of mindfulness are we pay attention to now, to the present moment, to our mind, to our physical body, maybe to the external environment. So that could be sounds, you know, sensations, heat, cold, looking around at the sky, seeing a tree and just noticing, wow, that tree looks amazing today. It also involves starting to see thoughts as mental events rather than getting kind of tied into it's a fact. So that negative thought that comes into your mind, it's just recognizing it's just a thought. It might involve recognizing and then starting to change automatic patterns that we have, how we react to stress or difficult situations. So as we start to get tense, are we starting to want to snap back at that difficult patient or difficult colleague? And it's just being aware, oh, I'm starting to feel irritable now. What am I going to do? And then it's responding and making choices in line with who we want to be as a person, as a human, as a clinician. It's a little bit about approaching, so rather than avoiding. So it's being willing to accept I'm feeling stressed and tense. That doesn't mean I like it, but actually sort of feeling like I shouldn't be feeling this way actually can increase the stress and tension further. So it's kind of finding space to hold it within. I sometimes talk about this being like a TARDIS, where the inside is bigger than the outside. So you've got room to have all of the difficult thoughts, all of the difficult feelings, and the good ones, and everything, all of our experiences, and just making a bit more room to hold it all inside without it sort of overwhelming. And then being able to choose what to do for you, what's the right thing to do for you as your next moment. And there's an attitude that goes with that of being curious, of having some compassion for yourself and for the world and for other people, and a sort of sense of kindness. And it also involves noticing and acknowledging things that are going well, the positive moments, that kind of a smile with a colleague and enjoying that cup of tea. The sun's coming up. I can just see it outside my window right now, and it actually looks really lovely. And so it's just having that awareness of that at the same time. So we're going to do 3 brief mindfulness practices that will be sort of 4 or 5 minutes long this morning, really just to introduce you to some different types of mindfulness. This is more of a taster than a kind of full-on mindfulness training session, and maybe give you some ideas. There are some resources that will come later. You'll be able to get that in the download, and questions. I'll try and leave some time for questions at the end as well. Okay, so we're going to just move on to the first practice, which is just mindfulness of movement. Because actually mindfulness doesn't mean you have to be physically sitting still. And for some people, and I'm probably one of them, sitting is actually not very, is quite difficult and can actually lead to an increased sense of tension. So mindfulness is just about focusing your awareness on a designated object for a period of time. And movement can be great if you're feeling tired or sleepy, or if you have a very active mind. It can kind of anchor you back in the present with some physical sensations. So today we're going to just do some very simple movements that you can do, some mindful movements you can do when you're sitting. And you could do these over the day if you're starting to get sleepy or tired, when you're watching any of the other lectures as you're going on. So I would really encourage you to kind of participate in the session, just have a go, see where you're at, try it out, and then ask me any questions at the end. So let's just start by sitting in an upright position, okay, pelvis neutral and your spine erect, following its natural curves. And just allow gravity to sink your weight into the chair, into the floor. Let your shoulders drop away from your ears, breathing naturally. And we're just going to start with a toes up, heels up movement, which increases blood flow to the feet and ultimately to the rest of your body. So just as you breathe in, lift up your heels. And as you breathe out, release your heels and gently lift up your toes. Don't force the movement or try to overstretch if you feel tight. Just inhale and lift your heels. Exhale and lift the toes. And just rocking up and down for a few slow breaths at your own pace. Notice the changing sensations in your legs and back. Inhale, lift your heels. Exhale, and lift your toes. Now slow the movement down. Press your heels down and just pause for a moment. Noticing the sensation against the ground, being aware of any tightness in the calf. Now really slowly allow your foot to go down flat on the floor, just really aware of the sensation. And then lifting your heel, draw it upwards, just noticing the pressure of the ball of your foot on the floor. You might wriggle your toes a little, just feeling your physical body. And then let your feet go flat on the ground. We're just going to do some shoulder rolls. Bring your shoulders up towards your ears. Draw your shoulder blades together, maybe backwards, and then drop them back and down, opening up the chest. Bring your shoulders back up towards your ears. Draw them together and then drop them back and down. Just rolling your shoulders slowly at your own pace, really feeling every part of the movement. Try and notice where they move easily and where they might meet some resistance. Don't force the movement. When you're ready, switch directions and slowly roll forwards a few times. Now I'm just going to finish with a rocking chair movement. So just lean forward on your chair so that you've got a bit of space between your back and the back of the chair, and then just grab hold of your knees. It's a bit like cat-cow in yoga, if anyone's familiar with that. And as you breathe in, just draw your chest forwards through your arms, arching the back and maybe looking upwards. And as you breathe out, drop your chin towards your chest and let there be a stretch between the shoulder blades. So inhale, forwards and upwards, looking up. Exhale, chin to chest, round your back. And last one. Inhale, looking up. And exhale, arching your back, dropping your chin. And just letting go of the movement now, maybe coming back up to seated. Just pause for a moment, let a breath out. Just notice how your body's feeling. Just run your attention from feet all the way up through your body, up to the head, and just notice if there's any tingling, any changing, any sense of aliveness that's come through physical movements. And it's really amazing how even small ones can actually have a really significant effect on the body. We're just going to move on to a short mindfulness of the breath practice, because the breath can be really helpful as an anchor to help keep us grounded, because we're always breathing. And also because for many people, but not everyone, paying attention to the breath can be quite soothing and calming. So we're going to do a short mindfulness practice, just noticing and being aware of our breath and using the breath to settle our body and our minds. So I'd invite you to sit comfortably, and you might want to gently close your eyes or soften and lower your gaze. Allow your body and breathing to settle after the last movement exercise. And it can sometimes help to start with 1 or 2 slow, sigh, audible breaths. A really slow exhale. And the sigh breath helps to do diaphragmatic breathing. And slow exhales help stimulate the parasympathetic nervous system to create a sense of rest and connection. So allow yourself to fall into a steady, comfortable rhythm of breathing. And just bring your attention to the physical movement of air in and out of your body. We're going to follow the journey of the breath. So let's start at your nostrils. Just noticing inside your nose the change in temperature at the tip with each breath. Breathing in and breathing out. And follow the air into the back of your nose and throat. Into your chest. Just notice the gentle opening and expansion of your chest as air is drawn into your lungs, and the relaxation and letting go as it flows out again. Can you feel the rise of your abdomen as your diaphragm expands and contracts to draw air into the body? You might notice it rising forwards and pushing outwards, and then be aware as it relaxes and falls, releasing air back out. Breathing in and breathing out. And just noticing the slight pause, the sense of stillness in the body between each breath, like resting at the top of the hill as we breathe in before the next breath flows outwards again. And your mind will naturally wander away from the sensation of breathing. Don't worry about how often this happens. Each time, just gently bring your awareness back to that physical sensation of breathing, and you can choose your anchor where it feels comfortable for you. Breathing in and breathing out. Belly rising and falling. Noticing the soothing rhythm of each breath. Feeling your whole body breathe. Noticing how your whole body is gently rocked and maybe soothed by the rhythm of your steady breathing. There's nothing else you need to do right now. No thinking, no planning, no doing. Just be here. Allow your breath to comfort and nourish you. Now taking a final moment, coming to rest with a final slow sigh exhale. Remember that whatever life throws at you, you can always come back to your ever-present breath. Okay, so we're going to finish with a short gratitude practice. During a crisis like the COVID-19 pandemic, it's very easy to spend a lot of our time focusing on threat and risk. And it becomes crucially important for our well-being to make sure that we also actively focus our attention on some of the other aspects of life, things we can be grateful for or appreciate despite the difficulties we're facing. So we're just going to spend the last few minutes looking for some small things we can cultivate a sense of gratitude or thankfulness for, which can help build our sense of resilience, our well-being, and just encourage a sense of hope, even when we're facing such challenges that I know everyone's facing right now. So if your eyes are open again, you might want to just close them and just look down with a soft focus, or look down with a soft focus. Take a breath or two and just settle into a still, comfortable position. And we're going to use our 5 senses to help create this sense of gratitude. So start by bringing to mind a sight that you appreciate visually, something that you might be grateful for. It could be a colour, a shape, a movement, the sunlight streaming through a window, the patterns of water as rain splashes onto the ground. Perhaps it's the sight of someone's face, their eyes, their smile, or a beautiful view somewhere on the other side of the world, or the view from your window. The expansive countryside, staring out to sea, or a building that you love, or a tree rooted in the ground, branches waving gently in the wind. And just bring to mind the colours, shades, shapes, and expressions. Take a moment to rest in this visual image of something you appreciate. Perhaps even being grateful for being able to use our vision to experience the amazing world of colour and shape. Breathe in and allow yourself to rest in the experience of gentle gratitude. And now moving on to the experience of taste. Allow something to come to mind that has a taste that you enjoy or are grateful to experience. Breathe in and allow yourself to gently savour the taste. What aspect do you most enjoy? Is it the flavour, the smell, the texture? Is it being warmed or being cooled down by something refreshing? Or the people that you share this with and those memories? And just perhaps also thinking about how the food or drink that generates this flavour is able to come to you. Taking a moment to think of all the people who've been involved, maybe right across the world, maybe in growing the ingredients, in transporting it, in selling it to you, harvesting, and just taking a moment to wish well to everyone who's been involved in this chain that brings this to you. A gentle wishing of thanks and appreciation for their efforts. And we'll just move on to the sense of touch and texture. Bringing to mind a physical experience that you appreciate. You might have a beautiful pet that you love to stroke, or some lovely material with a texture that feels warm to the touch. It might be the feeling of water streaming onto you in the shower. You might offer yourself a gentle touch by stroking your own arm from the shoulder down to the hand and just repeating this a few times. Or you might lift a hand and place it over your own heart, just noticing the warmth and pressure, sending yourself a sense of well-wishing and kindness, being grateful to ourselves for everything we do each day, all the efforts we make, just acknowledging and offering ourselves thanks and appreciation. And we'll finish by just thinking about some of the other people and beings we're connected to and have in our lives. This might be one person or a group of people that you care about, or an animal that you share a loving connection with. It may be someone you're close to or far away. You may see them frequently or rarely. You may be distanced from them right now for many reasons. And just allow yourself to feel a sense of appreciation for this being or person. Allow gratitude to come up naturally without being forced. And just let yourself sink into the feeling, surrender to it. Maybe notice where you feel it in your body. You might have a gentle expression, a small smile on your face, a warmth in your heart. Maybe bring to mind a quality that you value in this person, their kindness, their humour, their love, their strength, honesty. You might imagine making eye contact, sharing a loving gaze with somebody we care about. And if you're distanced from this person in some way, just giving yourself a moment to acknowledge and allow any sense of loss, any fears or concerns for them, sending them love and care, and offering yourself a sense of kindness and compassion for any difficult feelings that we might be feeling. And as we come to the end of this practice in the session, you might choose to carry this attitude of being grateful and thankful with you through the day, and just come back to it at any time that you need it. And sometimes spending 30 seconds before going to sleep each night, just bringing some thoughts about things we appreciate to mind, can be a really powerful way of getting a good night's sleep. So just bringing your awareness back to your body. Take a breath in and just a gentle, long sigh out. And blinking your eyes open as the practice comes to a close. Okay, so thank you everybody for being with me this morning. I hope that was so. I realised I didn't move the slides on. I got so mindful that I didn't move my slides onto the different ones. So I appreciate I was so focused on my own body there that I lost attention. That was perhaps it wasn't mindful enough, but I was kind of in my body and I was doing the practice along with you all. There are some resources there, so you'll be able to download those afterwards. But does anyone have any questions that they'd like to ask about mindfulness? So the session's officially due to finish at 8:30, and if you need to go off, have some breakfast, that will be absolutely fine. If anyone wants to ask any specific questions, I'll hang around for sort of 5 minutes just to allow you time to do that. So I've got a few comments saying thank you. So I appreciate that. We're also going to be sharing some there's a feedback link that's going to be coming up too. So I'd really ask you to would really ask you to fill that in so that we can get some feedback about the session, so I can learn and make any changes. But I'm getting a few kind of comments on the kind of conversation that people are appreciating it, and I would have to say I appreciate hearing those, because that sense of wanting to contribute to support people through such tough times. So really kind of you to say that. So let's have a list of, so the list of resources, yes, that will be on the download. It's a PDF file, so you'll be able to access that. I'm just having a look to see if there's any other questions. So learning more about how to learn more about mindfulness for stress management. I mean, there's a lot of different ways to learn mindfulness, and it's partly a question of how much time you want to commit to it. I would recommend just picking an app, and there's some great apps like Headspace. There's also Insight Timer and Headspace for those of you in the UK who work for the NHS, you can access that for free. Insight Timer is a free app if you can stream, and that's got a huge number. I've got a site on there, but there's loads of other mindfulness practitioners. You might choose to do some formal mindfulness training, something like mindfulness-based stress reduction is a kind of stress management approach to using mindfulness. So that might be a really good way to do that. So if anyone's got any other questions, I'm just having a look through. So I'm glad I'm hearing some comments that it was a really nice way to start the day. And, you know, I would really encourage you to, maybe when you're having a shower, you know, mindfulness doesn't have to take extra time. I guess that's the way that I practice, is that I weave it into my day. I'm not someone who really likes to sit, and there are people who really get benefit from finding 5 or 10 minutes to sit and do a kind of formal breathing practice. And if that's you, then please do that. However, if you're someone who kind of gets caught up in the business of the day, then I would just recommend just find your moment. So when you're in the shower, if you're walking to work, if you're walking up the stairs, feel your feet on the ground, just have a breath. And that can be all mindfulness has to be. Okay. So someone's asking how to practice at work. And again, it might be, depending on what role you do, just finding a moment. It might be popping into the loo and just sitting down and breathing. It might be in between patients, sitting, settling your body, just grounding yourself and doing 3 slow exhales. It may be just when you're saying goodbye to your kids and you hug them. I do sometimes do a mindful hug with my children. So I'll do 3 breaths, a 3-breath hug, where I match my breathing to them. And it's just a lovely way of kind of connecting with somebody a little bit more slowly. So again, obviously, I don't recommend doing that with your patients, but you might do it before you leave and work with somebody you care about. So it's just finding those moments to pause and notice, maybe bring you some physical movement. So you might stretch your arms out wide, feel that stretch, do the hugging movement, just lift your feet, just bring your awareness back to your physical body, ground yourself. And the other thing you can do is a stop, which is stop. S is for stop, just stop and pause if you're starting to feel tense. And then take 3 slow breaths. This T is for take 3 breaths. Observe. O is for observe what's happening inside. Okay, how am I feeling? What's going on for me? And then proceed. What do I need to do to take care of myself and others in this moment? So it's just slowing down and just taking a moment to be aware of what you need to do to look after yourself through your super busy day. Okay, so I'm going to have a look for one last question. So is this a type of meditation? Was one question. So meditation is a form of kind of formal mindfulness. So what people sometimes wonder, what is the difference? So meditation is a practice where you sit down and you pay attention to your breathing, and there are lots of different meditation practices. So mindfulness is a little bit broader than that. It's more about just paying attention. So it might involve paying attention through doing a formal mindful meditation practice, but it doesn't have to be as formal as that. And it can be, as I've been talking about, just these little ways to weave it into your moment. And so it really depends what works for you, whether you're someone who actually would really benefit from creating some time to set up a mindfulness practice, or whether actually you just want to be a little bit more aware, self-aware. The other great time to do it is through physical activity. So I do a little bit of really gentle jogging, and I try and do mindful jogging where I'm aware of my feet on the ground, where I'm looking at the sky, noticing the trees, noticing smells, just being really aware of where I am and what I'm doing. And I find that's a really nice way to kind of feel, it kind of creates a well-being element to the exercise, as opposed to it just being how fast am I running. And I try and let go of all of that and just be there and enjoy the practice. Okay, so I'm going to bring the session to a close now. So thank you all for your attention. Apologies again for not moving the slides on, but I hope that didn't get in the way of you enjoying the practice.